Hi, I'm Libby Trickett and I'm here at TAL's Future of Better Health event, and we are here to talk about how better medical understanding will help us all improve our well-being.
Hello and welcome. So are we getting better awareness around mental health? A gold medalist at multiple Olympics. Libby, you had to sort of live through a chapter yourself.
I first experienced depression when I retired from swimming. The transition into the real world is challenging, but then I think the biggest challenge to my mental health has definitely been the transition into parenthood. And that was the first moment where I realised that I desperately needed to get help.
Nick, if I can bring you in there, how does that sort of resonate with you, Libby's story?
I think what we're hearing, it's not just about being happy and getting a happy drug. It's about all these other aspects of our life that are really important to a meaningful life.
I'm part of Are You OK Day, which is just all about talking and asking the question, are you okay? But to have a belief that somehow someone is going through something you've gone through and they're okay, it's a great relief to yourself.
Sally, you talked about advice or a career service that helps people transition.
It's really trying to get people back to society. So, for example, if you're a painter and you've injured a limb, it might be difficult to go up and down a step ladder again. But it doesn't mean you should be written off from a society perspective. So how do we work with that person to find out what interests them and how they can get back to feel productive in life? I would love for us as life insurers and our partners to be an integral part of the health system and a tool in patients' tool bag to make them feel better, either from a prevention or from a support perspective.
What's the story with the current situation with social media and mental health?
The number of young adults, teenagers who are severely affected is actually remarkably small. It's not quite as bad as we are told. And there are also real positives around social media as well. We have online forums for support groups. You have people who reach out and actually find what has worked for other people. And yes, we can provide evidence as doctors and professionals, but actually people gain a lot of autonomy, and we shouldn't just demonise it for one aspect.
I think there's a fair bit of research that shows that despite the improvements, the health literacy of the Australian population, there's a lot of work that needs to be done about it.
There were 1,500 apps out there for treating depression that you could access on Google's store and the App Store.
1,500?
1,500. And so we went, okay, let's have a look. Do they work? There's evidence for 32 of them. This was 2 years ago. And of those 32, one of them actually was negative. It made you worse when we found the data. And several of them have absolutely no effect whatsoever. And we need to have a literacy across a whole range of the population about how we actually access the ones that work and provide the evidence and access to the ones that really do work.
Now, Libby, how do you manage that when suddenly everything changes? What's your advice there?
The biggest thing for me is finding a passion. We are in control of our health and our mental health. And if perhaps you might not be exactly where you want to be, communicating about it and hopefully encouraging people to take care of their own mental health, not in a reactive, in an acute sense, but in a preventative measure, taking care of ourselves every single day.